Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Amelia Bueche. She's an osteopathic physician. Today's Kevin MD article is This Perspective Will Change How Physicians Address Pain and Recovery. Amelia, it's been many years since you last been on. Welcome back to the show.
Thanks so much for having me back. Glad to be here.
All right, so we're going to talk about your latest Kevin MD article. So, before talking about the article itself, what made you write it in the first place?
Yeah, well, I was thinking back to when I did write articles back in 2020 around coaching and the transformation of my practice from clinical medicine to that space. And I experienced this film was kind of the impetus for the article. And it just dawned on me like the way to share the experience on the broadest scale was here. And so I was so grateful for that return and that platform. And it's felt like a rejuvenation and it's another pivot of my current work. And it just feels like the formula presented itself.
All right, fantastic. So, tell us about this film. Tell us about the article for those who didn't get a chance to read it.
Absolutely. So, Tipping the Pain Scale is a documentary, somewhat about the opioid crisis, also about substance abuse, but really it's about how we address pain. And it follows a number of different stories throughout the film. And there's a psychiatrist who speaks to how we're mismanaging pain and often not asking those deeper core questions. And I watched it from the perspective of support for people that I know who are in the experience of recovery from substance use. Also, because as a neuromusculoskeletal medicine physician, pain is the primary chief complaint that
Mhm.
walks through the door. And as a coach, right, thinking about how we connect all those different pieces of past trauma and feelings. And as I sat watching this documentary and it was talking about really the approach to others, so I was thinking about, okay, for patient care, there's great opportunities here. What really dawned on me was how deeply this impacts physicians for their own care. And
Mm.
in the practice of coaching, many of my clients and participants are physicians and other healthcare professionals. And pain looks a lot of different ways, and helping people to identify how pain might present and questions we might ask better and how to treat it and process it, integrate it more effectively was so profound. And I left the film and went home immediately and just I wrote probably four different articles and reflections. And then the one that came through that really presented itself for the platform was that encouragement to, yes, bring more compassion and awareness and curiosity to how we approach patients, but please let us also bring that to how we care for ourselves in the practice of medicine.
So, talk to us about some of the cases that you're seeing in your coaching practice. These clinicians who see patients in pain all the time. How does it affect
Mhm.
their professional psyche, and how does it affect them from the stories that you hear?
Yeah, absolutely. And I think it's the both and. So when you are a physician who is seeing pain presented to you lots of different ways, and that could be emotional pain, it can be physical pain, it could be acute, it could be chronic. We're faced with how do we properly manage this with medications? Do we have the time to ask
Mhm.
those deeper questions? Do we have a team in place for that? So just recognizing that we have an opportunity and also we have to look at our own capacity. Do we have the time? Do we have the resources? If we open up this wound with this patient, are we going to be able to help them handle that? And perhaps put them with the people that might connect and be able to support them longer term. So I think it's that piece, knowing we don't have to hold it all. But also, if someone isn't getting well or they're non compliant, these different phrases we have in the practice of medicine, maybe it is. Can we ask some different questions, right? Can we
Mhm.
get a little deeper on what is at the root cause of that? And then the other piece is really what I hope is for how we take care of ourselves. And pain, like I say, looks lots of different ways. And what I've noticed in working with lots of physicians is personal pain, particularly for high achievers, doesn't always look like dysfunction or inability to perform. But many times it comes in the way of overworking and high
Mhm.
achievement. And we look at physician suicide rates and how we can address those effectively. So checking in with ourselves and with one another. How are you actually, right? And having some space to answer and look deeper into those questions.
One of the things that you mentioned earlier is that sometimes clinicians aren't asking the right questions as to patients' root cause of their pain. So, tell
Mhm.
us about some of the obstacles that prevent them from doing so, and give us some tips in terms of the approach that clinicians can take to get at that root cause.
Yeah, absolutely. And again, if we have the time, which can feel like it's very compressed in the clinical space, but for example, if it's a misuse of medication or someone's struggling with substance abuse disorder, can we find out when did this begin? And what was happening then? And many times it is tied to a childhood experience or a
Mm.
certain traumatic event for that patient. And that was this self medication or this tool, this outlet that they had. And it's more of a symptom, right, than the actual root cause. And can we begin to allow ourselves to say, what is it you were feeling? Maybe you didn't have the tools to allow yourself to have those feelings and a support network to be there. And so getting a little deeper, and because we are tasked with symptom management and prescribing and all those pieces, but finding out the why behind it. And again, it can be really imperative to have a team. Maybe you have a social worker
Hmm.
in your office, you have a little bit, schedule a longer session and know you're going to ask those little deeper questions with the patient. And like I say, it is tough because sometimes you open that door, right? And it takes more time and you have to unpack it, and where you might feel like we're destabilizing a patient to get there. But especially those where you just feel like you have the same appointment over and over and over again, and we're never making any progress. Maybe that's the invitation to say, let's take it from a different angle, right? Let's just look a little deeper or peel back a new layer and see what might actually be here.
In your article, you said that physicians who treat pain need to practice some self compassion to manage their own personal pain. What exactly would that look like?
I think it is, again, willingness to ask ourselves those questions as well and decide, what does it look like to take care of me? And so often we are the ones taking care of everyone else. We're not given the chance to even talk about what our needs might be. And then we don't even know what they are. Many times in a group coaching session in particular, if we say, what is it that you need or that you want? It'll be crickets because we're just not even given the space
Hmm.
to talk about that because we're so often tasked with taking care of everyone else. So being willing to see, I have needs, they might not be being met, and I can have compassion for maybe where they weren't met by other people. And then I might be able to start meeting them for myself and then start to shift the lens and notice perhaps those needs are being met, but I just don't even recognize it when it's happening. And not a lot externally might even have to change, but our perspective can begin to shift to open that up and make some of those connections. It's normal to have needs and it's
Hmm.
okay to want them to be met. And oh, hey, here are some ways it might be happening. Maybe not on the grandest of scales, but if we can build that, then there's more space to continue to have success and ask for our needs to be met more directly.
Now, some of these concepts, what would they look like in a typical coaching session when a clinician comes to you with some of the issues that you're talking about? So, what would you say or do or coach them to help move past some of these obstacles?
Yeah, the beautiful thing about coaching, and that was really helped me pivot from my practice of medicine to that space, is it's connecting them with the wisdom that's within.
Hmm.
And that's true for us, and that's true for our patients, and that inherent self healing capacity, or as an osteopathic physician, that's a core component. So it's holding space, letting them tell their story, and then drawing out, I heard you say this. Can you tell me more?
Hmm.
And when you said that, what did it mean for you? What did it feel like for you in your body? And that was really new for me when I entered into coaching as, a training and a practice. I really was out of touch with feelings. I spent a lot of time in the logical space. That seemed really helpful, and to allow people to have the opportunity to feel what it is they're feeling, including pain. Because sometimes we
Hmm.
don't even know, right? We might have just built up a really high tolerance to pain and we've just allowed ourselves to be in that space and say, oh, actually, right, this does hurt. It doesn't feel good. It's
Yeah.
not sustainable, and let me address that. So it's really holding space for them to have some recognition and find the answers. And sometimes that's frustrating because we want answers and a prescription and a rubric, and there isn't truly, right? It's one beautiful way that's within you. But the also good news is that means it's custom for you and it's going to be the most effective because it is your actual answer. And that's what I love the most about coaching is
Hmm.
connecting people back to themselves and back to their source and back to those origin stories that we sometimes forget through all those years of training and practice.
Another thing that you touched upon in your article would be the use of substance abuse in the medical field and the stigma surrounding that. Tell us about some of the things you wrote about that.
Well, it's interesting, right? We just most recently had an article noting that alcohol, there's no safe amount, right? And we're looking at the carcinogen impacts, and there's been lots of different dialogues amongst physicians regarding that. And we know, right, there are harmful aspects to the substance, but it's also very normalized
Hmm.
socially and culturally. And we can think, yes, or get to the end of the day and have a glass of wine, and there can be factors that are useful in there. But checking in to say, is this me, right? Avoiding or masking
Hmm.
and utilizing this to escape my life, which sometimes can feel helpful and useful. But are there opportunities perhaps to have other coping mechanisms to be able to handle what's happening to me? And then if you are noticing it is entering into overuse or abuse category, how can you find those safe outlets to address it? Because it does come, right, with different punitive aspects. There can be shame, there can be licensure risk. And can we do better in those practices? And the film touches on different policy development, not necessarily specifically around this, but as a health policy fellow myself, how can we, on a broader scale, have better systems so it's safe to ask for help and it's not, right, a threat to you or your practice of medicine?
So, from a policy standpoint, what are some of the things that that film, or from your experience as a health policy fellow, what are some policy suggestions that we can implement to help this?
The one that was key and core in the film was allowing people to have inpatient admissions, even involuntary, for substance use. And that was really interesting and somewhat new to me. that oftentimes, if you're threatening harm or if there are other reasons, you can be admitted. But if it's specifically for, overt intoxication, that
Mhm.
always doesn't qualify and it would often get people kicked out of the system and then back to the streets, and this cycle would continue. And there were success stories around making that more accessible and available so patients could get the help that they need. From the physician standpoint, this is a newer frontier for me in investigating what are the options, right? What are those safe reporting routes? And I included in the article some links for places. There are some physician specific AA groups, for example, right? So there are some rooms where you can maintain anonymity specific to the profession and get help that you need. And then looking at how some of these more formal systems aren't
Mhm.
always super safe and effective. And can we do better? And I don't have the answers just yet, but that's a place to begin to learn. And if those who are listening do have more experience or have had better success themselves or with a colleague, I would encourage them to make that known. And we have lots of different social media platforms, yours and others, of course, as well. And let's offer up what are those meaningful and safer spaces to get the help that we need. And yes, formally, but then also, can we open dialogue to say, I
Mhm.
notice I'm utilizing these substances. Maybe that's not the best option. And even though it's socially acceptable, can we encourage each other perhaps to seek reform and self care and compassion without that as the primary tool?
The last thing that you touched upon in your article was addressing pain at a cellular level, and that can sometimes can contribute to systemic recovery and change. So, exactly what does that mean?
For me, some of that's experiential. So I would say sitting in that film, it was like my whole self was called into being. And that's on the pragmatic level, the physician, the health policy fellow, the coach, the parent, the friend, the supporter. I felt like everything was like, bring everything that you do together. And this is calling you to action in this space. And it feels transformative. And it really is a sensory experience. It was like, I'm going to be changed from having watched this film and what it called me to do. And I had a similar experience a few weeks prior at a concert with Yo-Yo Ma. And I'm a cellist myself. I followed him my whole life. And he's a brilliant human on many levels, but he called in that space us to a work of planetary humanism, saying we could do better. And I remember just sitting in that space and I felt my whole body shift and change and say yes, right? And the music was helpful and the dialogue was helpful, but it was just this sense of like all of me was integrated. And I invite us to allow ourselves to experience that. So where are those spaces and times in your life when you have felt like all parts of you were brought online, right? Everything was activated, and not in a reactive way, but in this invigorating way where you connect all those different pieces of you and allow that to guide you forward. And that does happen in coaching sessions, right? When we're able to connect with our feelings and those core thoughts and recognize patterns that we've had, there's just this resonance that happens. It says, oh, right, like this is what I meant to be
Mhm.
doing, or the question I want to ask, or the next step for me. And what I would invite listeners to do is just to be open to that, right? Open to resonance and maybe tracking back to see where that could happen. And then looking forward to creating spaces for ourselves and for each other to invite that in.
We're talking to Amelia Bueche. She's an osteopathic physician. Today's Kevin MD article is This Perspective Will Change How Physicians Address Pain and Recovery. Amelia, let's end with some of your take home messages that you want to share with the Kevin MD audience.
Think just enhancing your barometer for sensing pain in others and in yourself, and being willing to see it might look and feel other ways. And it's not to be detrimental or derogatory, but it's to say, here's an opportunity for me to recognize this so I can take care of it better in myself and to show up in a space with my patients with a more robust capacity to ask and hold space for the answers to these meaningful questions.
Amelia, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thank you for the opportunity.